Good afternoon, Trinidad and Tobago. Welcome to Women of Promise, a program specifically for the women of Trinidad and Tobago. I am your host, Renata Singh, and of course, I like to remind you guys, I am a woman just like you, navigating through life's challenges, the highs, the lows, and all the in-betweens. And I'm here to remind you that we are better together. We're kicking off April with a new topic, mental health. I know that's a broad one and perhaps a little bit heavy, but we're here to unpack it. And here with me today is Dr. Hazel Othello. She's a psychiatrist and she'll be helping me unpack this topic today. Hi, Dr. Othello. How are you doing?
I'm fine, thank you, and good afternoon, Renata, and thank you so much for having me on the program.
I'm really excited for this topic. Again, like I mentioned, I know sometimes it's a heavy one.
It can be.
But it's a necessary conversation to have.
Absolutely.
Yeah, and I think we're going to start with the basics. What is mental health? Because I feel like people have so many different opinions and definitions of what mental health is.
And they do, and people have lots of opinions, and unfortunately there's a lot of misinformation around what exactly mental health is. But if you think about it, the definition of mental health springs from the definition of health. When we talk about health, we talk about a holistic sense of well-being. We don't just talk about the absence of a diagnosis.
Okay.
And mental health is the same thing. It's the holistic, all-around well-being of a person, not just the absence of a mental health diagnosis, a disease, and disorder. So it speaks to all areas of your life. It speaks to being able to enjoy life and be able to contribute to society, to make some kind of contribution in whatever way you can.
Yeah.
All those things are important to mental health. In other words, it speaks to your functionality, your ability to function well. So, I always say, if we talk about mental health, we have to talk about the brain.
Okay.
Right? If we talk about cardiac health, we talk about the heart.
Right.
Okay? So when we talk about mental health, we talk about the brain, and the brain is responsible for so much of what we do. So much of how we perceive the world, so much of how we communicate.
Yes.
And all those things are important when you think about mental health.
Yeah, absolutely. Could you unpack in terms of like the different aspects that impact mental health in terms of like the holistic? You said holistic, so.
Yeah. Okay. As you know, God made us body, soul, and spirit, right? We're, our favorite pastor of years gone by used to say, I am a spirit. I have a body. I live in a body.
I live in a body.
I'm a spirit.
I have a soul. Yes.
And I live in a body.
Yes,
That's
and I
right.
live in a
Got
body.
it. Yes. Haven't said it for so long. But we live in a body. And the body can break down. The body can not function the way it was intended to, as I said, your heart, your lungs, your liver, your brain. Any function, any part of the body can malfunction. But everything that we interact with in our environment can affect the body, right? We want to breathe clean air, we want to drink water, we want to eat well, we want to sleep. And in the same way that those things can affect the body, they can also affect the brain.
Okay.
So that the basics of nutrition and all the things that affect our physical well-being also affect our mental well-being, but also the situations we face on a day-to-day basis and how we cope with those situations can have a tremendous impact on our mental health.
Yeah.
Because it affects what we think and how we think.
Yes.
And if all day long you're thinking about something that is difficult and challenging and you can't think of a solution or a way through, it can begin to affect your emotions. And the way the body is built, when it starts to affect the emotions, certain chemicals are released into the bloodstream that affect what we call the end organs.
Okay.
Yeah, so different organs start to react.
Wow.
Literally react to our thought patterns.
Wow, that's interesting.
Yeah.
So I mean, we talk in a Christian context, we talk about, what we think about and the power of our words and our thoughts and what we even allow into our space, what we consume in terms of like content and stuff like that. And I mean, we know it has an impact, but you're talking about a different level of impact. I guess something that I am not aware of.
Let's use a simple example. I'm walking down the street.
Right.
The neighbor forgot to close his gate.
Yeah.
And he has a German Shepherd that's not too friendly. So I see Mr. German Shepherd coming out towards me. I freeze. That's the natural reaction, what we call fight or flight.
Yes.
You either decide I'm going to take on this dog today, or you decide I need to get out of here.
Right.
Right? But the body has a set of chemical reactions that prepare you for either response.
Okay.
And if you're going to fight the dog, which of course is not wise, or even if you're going to run away, you need muscle strength. So you need oxygen going to the muscles. You need your heart rate to go up. You need to breathe more rapidly. If you notice, when you run a race, you come out and you're out of breath, right? So the body has to prepare itself for all the activities that are involved in running away from this dog. What happens when we linger on difficult situations for a long time is the body continues to do that even when there isn't a stressful event.
Oh, wow. Okay. So we're not able to distinguish.
Continue to be released into the bloodstream and to produce the desired effect. Well, at that point, the undesirable effect of your heart racing, your breathing fast, your muscles tensing up. And that's how we feel when we're stressed.
Yes.
Right? Your stomach, I mean, we all know about butterflies in the stomach, right? And the good old days
Yes.
when we had to stand up and sing.
Yes.
And we feel those butterflies in the stomach when we know that people out there listening to us, and we hope we hit those notes correctly.
Yeah.
Right? And you know, some people during intense stress get things like diarrhea and nausea and all sorts of physical symptoms.
Yes.
Right? So those are actually the effects of what we call a chemical called adrenaline.
Yes.
Being released into the bloodstream.
Okay.
Right? Other chemicals called like cortisol and so on are involved. It's quite a complex process that I wouldn't go into in any detail. But just to let you know that this is real biology. This is not hocus pocus. It's not something people make up. And the reason why I focus on the fact that it's real biology, because sometimes in Christian circles we get down on people when they're struggling.
Yeah.
And when somebody's depressed, we think they don't have enough faith.
Yes.
Just, shake that off.
Yeah.
Be of good, yes, it's important to be of good courage. But
it's something real happening.
Sometimes you need some support to get there and to stay there.
And that's okay.
It's okay. It's okay to not always be okay.
Yeah, and I think
that's why we have each other to help us.
Absolutely. How in control are we though in terms of I guess identifying when we're in stressful situations, but when it's like almost like a pattern?
Everyone has some ways of coping, right?
Okay.
We develop those as we grow, right? Sometimes people develop healthy coping patterns, sometimes they develop unhealthy coping patterns, right? But when your coping skills, when a situation that impacts you is such that it exceeds your capacity to cope, that's when you start to feel extreme distress and and that's when symptoms can begin to come on and things can become difficult to control and difficult for you to pull yourself back on your own.
Is it easier for a person to notice that, or people around the person to?
Sometimes it varies.
Okay.
I mean, you may know that you're not feeling too well within yourself. You may know that your heart is racing, and you know that you're feeling a little anxious or a little irritable.
Yeah.
You're getting vexed more easily than you normally would. But sometimes you don't realize it. And sometimes you're snapping at people and you don't realize it until somebody says, what's going on with you? That's not you.
Yes.
So sometimes it's important for the people in our immediate environment to give us that feedback.
Yeah. I think that's why it's so important. Community is important.
Yeah.
Having a support system is important. That may look like friends. That may look like family members. It may look like leaders. It looks different. But the point is, it's important to have it present in your life.
It's important to have people that you can reach out to and get the support that you need when you need it.
Yeah. What are some of the signs, though, the telltale signs? I know there probably are a lot, and it's probably quite a complex conversation to have, but what are some things we could be looking for?
I think the easiest way to conceptualize that is using a model that has become quite popular, and it's using the diagram of a pyramid, right? And every level of the pyramid represents a different amount of distress or discomfort. At the bottom of the pyramid, where most people are most of the time, is no distress, no problem. If you're enjoying your life, things are going the way you would like them to go, or if things are not 100%, you're coping well and everything is good. That's where we don't love to be all the time. But right? In this life, you shall.
Life sometimes, right?
Life happens, right? But the level above that is the level that we call mental distress. And that is when things begin to upset us.
Okay.
So we begin to get a little angry and a little annoyed, a little irritable, because we're dealing with situations that are difficult to deal with. Or you may have been dealing with a situation for a long time and coping reasonably well for a long time, but the situation is prolonged, so now you start to get fed up.
Okay.
How long do I have to put up with this? How much more of this do I have to deal with? Right? So that that level of distress, it's not an illness, it's not a disorder of any kind, but you know that you're in some distress. Okay. And other people see it in you when they start to see the irritability and things like that. And then there's the level above distress, and that's where we talk about mental health problems.
Okay.
Right, so that's where things begin to become a little difficult, and it starts to affect your physical functioning.
Okay.
Right, so that's where you start to have trouble falling asleep, or when you fall asleep, you wake up in the middle of the night. You might have woken up just to go to the bathroom, but it is when you lie back down and you start to think about a problem, and it starts to spiral in your mind, and you start off thinking about it, and then you start to think, well, if I don't do this, or don't get this sorted out, that will happen. And then if that happens, that will happen.
And you keep going down the road.
It's building upon itself. And the next thing you know, you're constantly in a state of worry.
Yeah.
About things that may never happen.
Wow, that's a really
a
key point there.
Yeah.
I have been that person in the bed, and then those thoughts keep going, and you're like,
we've all been there.
Yeah.
Right. And we think about all the possible things that can be result from this problem if we don't get it solved.
Yeah.
But more than likely we're gonna get it solved.
Yeah.
And if it tarries a little bit, and if we have to wait a little bit, with some support, we can get through that.
Yes.
So that we don't have to fall apart completely. Right? So that's the difficult part where, and during that part, people may start to feel a little bit of hopelessness, a bit of despair.
Okay.
Is this ever going to get better? Maybe it's never. You start to think the negative thoughts. Maybe this is never going to get better.
Does it have any specific stage that you feel like it's common to go into that mode of isolation?
Yes. During that mental health problem stage, isolation can be a feature, and it continues into the next stages, which is where you have, if at any stage, if it's dealt with, you return to normal, you return to that baseline, right? And you don't have to go through all the different stages on the way down to get back to the baseline.
Okay.
But if you don't deal with this, if you don't cope well, or you don't find solutions, or you don't find ways of coping, if it's something that's persistent, then it can escalate to the point of a mental health disorder or mental health disease.
Okay.
And that's where you need professional assistance in order to get through it. And
so it's important at that phase, or at this phase, or just to the lead up, before it gets to be, like you're mentioning, an illness, a named illness.
Yeah.
It's important. Hey, I'm noticing certain things.
Yes.
That you seek the necessary help in those.
Absolutely.
Because you don't want to get to that place.
You don't want to get to the place if you could help it. Now, as an aside, I must make to the point that there are some mental health illnesses that happen just like any other biological illness, and you can't identify any stressful factor that led to it.
Okay.
Right? The person who's diabetic didn't get diabetic because they were going through stress.
Yeah.
Right? Now, if you're diabetic, stress can raise your blood sugar.
Right.
When that cortisol starts to be released into the bloodstream, right? So, similarly, the hypertensive person didn't become hypertensive purely on the basis of stress,
Okay.
right? Similarly, the person with schizophrenia or bipolar disorder didn't develop that mental health disease purely on the basis of stress.
Okay.
There may have been stress factors leading
Involved,
to
right.
the onset of the illness or leading to a relapse.
Right.
But that's not all that's involved. There's a whole lot of other things involved as well.
Got you. And it kind of puts some perspective in place in terms of, the conversation. Hey, just shake it off. Just, this is as a result of some of the choices you
Yeah.
made or the fact that you probably kind of prolonged,
And you see that just shake it off statement?
Yes.
It is one of the most painful statements for the person going
Yes.
through it to hear
Absolutely.
from loved ones, because they know that if they could have shaken it off, they would have done so a long
Yeah.
time ago, because nobody wants to feel like
Exactly.
that. Nobody wants to be depressed.
Exactly. And this is the thing. Just because you don't understand it, you've not experienced it, doesn't mean that it's not real.
That's right. Unfortunately, we haven't done a good job of communicating as a society when it comes to mental health. It's getting better now, and I think COVID even helped us a little bit with that.
Yeah.
Because we were forced to face our mental health during COVID.
Absolutely.
But the reality is, because we haven't done as much in terms of educating the public about issues surrounding mental health, people really genuinely do not understand. So the person who is saying shake it off, they're not being mean. They're just speaking their understanding,
Yeah.
their level of
Yeah.
understanding of what's happening. So they think that because they've never faced a situation that they couldn't shake off, the other person can shake it off.
And then there is the comparison. Hey, I went through that exact same
Oh,
thing.
boy.
And I got through,
Yeah.
I did XYZ. So they're expecting you to approach the situation the same, but it affects people differently.
Or the parent who says, when I was growing up, we didn't have electricity, and we didn't
Yeah.
have internet,
Yeah.
and we had a fireside and a dirt oven, and all you have everything. What all you have to be depressed about?
Yeah.
If you
That's
have
real.
Yeah, if you have a brain, you could get depressed. It's as simple as that.
Okay, I like that. If you have a brain, you can get depressed. That is a very key point. But Dr. Othello, we're going to go to a short break. When we come back, we continue this discussion on mental health. We'll be right back.
Woman of Promise is back. The Grand Reset with our new host, Renata Singh.
Hey, it's your girl Renata, and you can join me and my special guests every Tuesday from 12:15 to 1 p.m. as we touch on issues that impact women of all ages, from knowing your worth and identity in Christ, fostering godly relationships, beauty, fashion, maintaining a healthy lifestyle, and more. And of course, we bring a biblical perspective to every discussion.
It's Woman of Promise, the Grand Reset, every Tuesday from 12:15 to 1 p.m. on Isaac 98.1 FM. Sponsored by Furniture Plus.
Don't wait. Save big at Furniture Plus today. Enjoy up to 65% off in-store and online. Shop deals on furniture, appliances, mattresses, and more. And pay just $1 down on credit plans. Hurry. Visit any Furniture Plus showroom today.
Welcome back to Woman of Promise. If you're not joining me, I am with psychiatrist Dr. Hazel Othello. We're talking about mental health. Before we went to break, we were discussing just the different phases. I hope I'm saying that properly. Different phases of mental health. And you said, Dr. Othello, it starts with your baseline, which is where you're normal. Then when you move into a little bit of distress, and then mental health problems. And now you're going to discuss the illness part of it, right?
Yes, so in the absence of intervention, or when intervention has not been effective, people get to the point where their body starts to react in an adverse way to what they're experiencing emotionally, right? So mental health can affect sleep, it can affect appetite, It can affect concentration. It can affect one's ability to socialize. It can affect your very ability to enjoy.
Okay.
So you're in situation, the initial stressful event is over, it's done with, but because it has already impacted you in this way, and your body has begun to react in this way, you're not enjoying anything. The best thing could happen to you, and it would be like nothing. You're just not. You've just lost that ability to enjoy. People lose their motivation to do the things they previously enjoyed doing. People feel extremely anxious.
Okay.
People get irritable, and I could go on and on and on. There are lots of symptoms that kind of can crop up in a number of different disorders.
Okay.
Right. So as clinicians, we base diagnosis on not just the person's history, but on their mental state at the time when we're examining them.
Okay.
So we look at the entire history, we look at what's happening to you right now, and based on what we're seeing and what we've heard from the history, we're able to say, okay, this is the disorder that's affecting you at this particular point in time.
Okay, is early detection possible?
Critical, not just possible, but critical. The earlier treatment starts for mental disorders is the better the outcome. Doesn't mean that it's hopeless for you if you started later on, but you get back to feeling well,
which is what you
quickly.
want.
You want to feel well, you want to enjoy life.
Yeah.
Right? So the quicker you get the treatment that you need, and treatment is not just only medication, right? It's medication and the psychosocial support that you need, whether it's therapy, but there are some other things like starting back your exercise and things like that. As you start to feel better, starting to do the things you enjoyed doing again, so that you start to literally rebuild the areas of your life that got neglected when you were not feeling well.
Okay, and that neglect does have a huge impact on our lives, and our well-being, like you're saying. But in terms of lifestyle, what sorts of lifestyle changes do we need to make in that phase when we're coming? We've now gotten diagnosis. What are some of the lifestyle changes that we would have to make?
Well, during that evaluation and initial treatment phase, your doctor or your therapist would have identified things that precipitated the illness or caused it to continue.
Okay.
Right? And they would, by helping you to understand those things that can vary from person to person.
Yes.
Each individual is able to realize what they need to work on and where they need to make changes in their lives. For instance, you may be the type of people who feel you have to solve everybody's problems.
Yeah.
You have to make it right for everybody.
Yes.
So, and when somebody in your family not where they ought to be and they're going through some struggle, you take it personally and you carry it.
The weight of it.
Yeah, you carry the weight of it yourself, right? So sometimes in situations like that, you need to let go.
Okay.
And you need to trust that you support them to the extent that you can, but you don't carry it personally.
Okay.
Right? So that you're there for them when they need you, but you're not destroying yourself in the process of trying to help them.
Yeah.
And sometimes it could be a thin dividing line, because you love them, you care about them, you want the best for them. Right? But you have to learn the distinction and understand where you're going overboard and where you're trying to do too much.
Yes.
And what you need to let go and leave alone, and
Wow, and I assume that's a journey.
It's a journey.
Especially if that's your default mode. Like, you're constantly in this race, like, oh my gosh, I need to fix this, And
sometimes it's not just actions, sometimes it's thought patterns.
Okay.
The way you think about things, right? Some people may tend to see everything in a catastrophic kind of dimension.
Yeah.
So you see the negative side of everything, or you see what could possibly go wrong in everything. So now you have to retrain your thinking. And that's not something that people can easily do on their own. You usually need to work with a therapist to learn to identify what we call the maladaptive thought patterns.
Okay.
Right? Something can be adaptive. It's helping you to adapt to life's situations. or it could be what we call maladaptive,
Okay.
causing you to adapt in unhealthy ways.
Okay.
Right? So as you start to identify the maladaptive thought patterns, you begin to teach yourself to literally trap them early and replace them with more adaptive thought patterns.
Okay. Wow. And I mean, that sounds easy, but
It's
I'm
not.
sure it's a lot of hard work
It's
that
not,
goes in. Yeah.
and the person who is working with you has to be trained specifically in doing that.
Okay. Okay. Got
Not
you.
every psychiatrist is trained in every type of therapy. In fact, many of us refer to the psychologists for
Okay.
those kind of therapeutic interventions.
Oh wow. So in that sphere there is also specializations. I
Yes.
assume. Okay.
There are different mental health workers who work together as a team in the best interest of the person. So there are people who I would refer to as psychologists. There are people who I would refer to a social worker.
Okay.
There are other mental health professionals. There are arts therapists, music therapists, dance therapists,
Wow.
all
Okay.
kinds. Yeah, there are different modalities in the creative arts sector that
Wow.
can be used in therapy to help people build their coping skills and their resilience, or sometimes just to help them to manage symptoms in cases where some symptoms aren't going to go away completely.
Yes.
They learn how to manage it and how to live as best as possible in spite of it.
Okay.
So an important part of treatment is being open to accepting those modalities of treatment and
Okay.
participating in what works best for you.
Okay. Wow. I didn't even know that. I'm learning things. But so we're talking coping. Let's shift the discussion a bit to support. Specific to family members. Let's just say the community of people around this person. How can they begin to support someone who is experiencing mental illness through that phase back to being healthy?
It starts with just being present and
Okay.
just being willing to listen.
Okay.
The person may not want to speak at first, but you let them know that you're there for them when they're ready to talk.
Okay.
Right? So at whatever point they feel they're ready to talk to someone, there is someone that they can talk to.
Okay.
And then it's about listening. As human beings, we like to talk. We like to jump in.
Yeah.
We like to offer solutions.
An advice.
An advice.
An opinion.
If it were me, I would have done this.
Uh-huh.
If it were me, that would have never happened to me because I would have done
Uh-huh.
A, B, C, D, and E.
Yeah.
No, let's not rush to judgment. Let's not, in other words, not be
Yeah.
judgmental towards them, and not try to give them. They don't want solutions, they just want to know that
You're there.
You're there to listen,
Okay.
right? And in a situation where, having listened, you are of the conclusion that this is more than I can help you with, then you suggest that they get another level of help.
Okay.
And you offer, if they would like it, to walk them through that process. If you want me to, I will go with you to
Yes.
see a general practitioner, or to see a psychologist, or to see a psychiatrist, or whatever you need. If you want me to go with you, I will go with you.
Yeah. Okay, that's it. I think that is so key in terms of like just listening, because you're right. We like to give our own input. I think it's natural, quote unquote natural, for persons who. And here's the thing about it, right? I feel like when we do go into that mode of giving our take, our little 2 cents, as they say, it kind of causes people to close up.
Of course, because you have not lived their journey. You do not know what they've been through.
Yeah.
You only know what you see on the surface, and you form your conclusions.
Yeah.
And you come into that relationship with your biases
Yeah. Yeah. Yeah.
and your ways of doing things, and the way you learn to cope. I always say to people, don't try to think through somebody else's brain for them.
Yeah.
You're not inside their brain,
Yeah.
so you cannot think for them.
Yes. And I'm guessing there's a certain level of open-mindedness
Yes.
that we as the person supporting need to approach a situation with. Like, hey, yeah, you may have your own thoughts and opinions, but there may be so many other things, like you said, under the surface that
Yeah.
you're not aware of.
Okay, for instance, if you want to use an example, two young women may have both gone through relationships that didn't work out.
Yeah.
You were seeing someone, you were interested in that person, you thought it would proceed all the way to marriage, etc., and something happened and it didn't work out. For one person, they may be able to laugh it off.
Right.
Or even if they're distressed, after a few weeks, they're like,
They're
you
back
know,
to-
I'm back to normal. You know what?
Yeah.
Forget him, I'm good. For somebody else, that could be devastating.
Yes.
It could feel like the end of
Of
the
the world. Yep.
because they built their perception of
correct.
their future world
Around us.
around the
person.
expectation that this person would be a part of it. Right? And based on all kinds of things in our earlier life, we learn differently how to cope with situations. So, and everybody's different, so that for me, and I'm saying me as an example, not me personally, but maybe I should just say for one person, to keep it simple, for one person, a breakup might be neither here nor there.
Okay.
But the day I wake up and I ain't seen enough money in the bank to pay my bills, that can be devastating. Because I've come from a situation of poverty.
Yes.
And I've
So
come
it's
to a
triggering.
place where I'm doing okay.
Yeah.
And the day I don't see that money in the bank, I start to think of, oh my gosh. And I start to remember the days when there wasn't food on the table, when we didn't know where the next meal was coming from. And this what is stressful for one person is not necessarily stressful
Stressful
for
for the other.
another person, and that's why we have to not be judgmental,
Yeah.
because we don't know what that person's journey was.
Absolutely. And what could be the trigger? Like,
Yeah.
I feel like we have triggers.
We do.
And it's different.
It varies from person to person.
Yeah, this is such a complex topic. Like, one shoe does not fit all.
And remember, we're a composite of genetic influences, environmental influences. All those things come together to make us the person that we are.
Yeah.
Right? We can't see the genetic influences, but they're there.
They're there. So genetics impact or influence our
They
mental
can.
health. Oh,
They
okay.
can.
So just
not-
like how you have hereditary medical illnesses, it's the same
yes,
for.
there are certain mental health disorders that run in families.
Wow. Okay.
So that if you have a close family member, a parent, or aunt, or uncle, somebody close who had that disorder, you are at what we call at greater risk.
risk,
It
okay.
doesn't mean that you will,
Okay.
but you
There's a
are
risk involved.
statistically at a greater risk of developing it than the person who did not.
Okay. Wow.
But it's so complex because it does not mean that if you did not have a genetic risk, you couldn't get it.
Okay.
Because we don't understand all our genetic risks.
Yes.
Our genetics is so complex
Yeah.
that we only know what we know.
Yeah. And I think it's an area that we're still learning, right?
Yeah.
Yeah. But we're going to go to another short break. When we come back, we wrap up this conversation. We're talking mental health. It's an exciting one. Don't go anywhere.
Woman of Promise is back. The Grand Reset with our new host, Renata Singh.
Hey, it's your girl Renata, and you can join me and my special guests every Tuesday from 12:15 to 1 p.m. as we touch on issues that impact women of all ages, from knowing your worth and identity in Christ, fostering godly relationships, beauty, fashion, maintaining a healthy lifestyle, and more. And of course, we bring a biblical perspective to every discussion.
It's Woman of Promise, the Grand Reset, every Tuesday from 12:15 to 1 p.m. on Isaac 98.1 FM. Sponsored by Furniture Plus.
Don't wait. Save big at Furniture Plus today. Enjoy up to 65% off in-store and online. Shop deals on furniture, appliances, mattresses, and more, and pay just $1 down on credit plans. Hurry. Visit any Furniture Plus showroom today.
Welcome back. We're wrapping up this conversation on mental health. I am with Dr. Hazel Othello. Dr. Othello, how can we protect our mental health?
We protect our mental health by taking care of ourselves, taking care of all areas of our lives. So we want to eat well,
Okay.
right? Try to have nutritious meals as far as possible. We want to make sure that we're getting enough sleep. And we know that at times that can be difficult with schedules, exams,
Yes.
all sorts of things, happen. But we try to get enough sleep.
Is there a
regardless.
recommended amount of hours? Or how does that go?
Actually, the 8-hour thing is a myth.
Okay.
There are people who need their 8 hours.
Okay.
And there's some people who can do well on 5 hours or 6 hours, whatever, their body. They just consistently do well on that. And if you ask them to stay in a bed for 8 hours straight, you will be torturing them. Right? But on average, anything less than 5 hours per night could
Okay.
be a bit problematic on a long-term basis.
Okay.
In other words, you had one night that you stayed up. I mean, most of us stay up all as night or when we have a family function. That's not going to affect your mental health.
Right.
But it's the pattern of consistently not getting enough sleep. Again, it affects your brain chemistry and can affect your health. Right? Exercise. Exercise is so important. Exercise releases chemicals called endorphins into the bloodstream. Endorphins are the happy chemicals.
Yes.
They make us feel better. Right? Once many of us have a little difficulty exercising consistently. And then one of the challenges that can occur if you're developing problems like anxiety and depression is you can lose that motivation to go out and exercise.
Yes.
And it kind of causes things to snowball. Right, so that as soon as I encourage patients as soon as possible to start back exercising.
Okay.
Very, very important. So, the sleep and the appetite, the rest, the exercise, those are things that help your physical body to be healthy. What we call self-care, basically taking care of yourself. But then there are things you have to do on other levels, right? And that's where community becomes important.
Okay.
Connection is important. That's why COVID was such a struggle.
Yes.
Because we couldn't connect.
We were
Everybody was
isolated.
in their pod.
Correct. It's
Right?
true.
We were isolated.
Yeah.
Right? And some people were locked down with people who they don't particularly get along well with.
AKA
and
some family.
Yeah. And there's
That's real.
There's nowhere to go.
Yeah, yeah.
Right? So healthy connections are important. Right? Healthy connections are important. At times when you can't physically go, find other ways to connect. Make a phone call, send a message, that kind of thing. Right? Connection on not just on the individual level, but on the community level.
Okay.
Being parts of groups, and that's where, for us as believers, that's where the church community comes in.
Yes.
And it's very important because, within your church community, there's usually that person
Yeah.
that you could go and talk to
Yeah.
in a difficult time, who will support you and encourage you and pray with you. But even when nothing is difficult, you call that person and you organize a little lime and you do something together.
Yeah, you don't
and
have to wait for
fun.
something
That's
bad to
right.
happen. So, yeah.
Yeah, we just say, let's do lunch today, or let's just go down to the mall and hang around for a bit. Or whatever you enjoy doing, right? Let's go play tennis.
Yes.
Right, so you're doing things that you enjoy.
Yes.
Whether it's crafting, whether it's sports, whatever. But doing things that give you a sense of fulfillment.
So it's important to have a little fun in your routine.
Yes. And in terms of, making lifestyle decisions like careers and so on, it's really, really important to pursue what you love.
Okay.
because a lot of the anxiety and the depression that we see in clinical practice is triggered by work-related stress.
Okay.
Now, if you really love what you do, at a particular point in time, you may have a boss who's not easy to get along with, but you love what you do.
Okay.
So you don't focus on that person, you just
Yeah.
keep doing what you love doing.
Yes.
But if you don't love what you do,
And you have
and the people you have to interact with while you're doing it,
a difficult,
Are
that's a
difficult.
different level of
and
stress.
you don't have a strategy in place to cope with that, because sometimes we don't always have a choice in terms of finding employment.
Yeah.
Sometimes you land where you land at that particular point in time.
Yeah.
You may not want to stay there, but it's what you need to pay the bills for
Yeah.
now.
Yeah.
And that's when you have to build the internal coping strategies to deal with the difficult people in that workplace, if there are difficult people, or to deal with your own emotional reaction when a task seems difficult and overwhelming and it feels like it's more than you can do. Sometimes you have to just stop and breathe and give yourself a little chance to relax, and then approach it again, and then you realize, wait a second, it's not so hard. I mean, we've all gone into that exam room where you turn over the paper and not one question look like it have anything that
You study.
And then you stop and you breathe.
Yes.
And then you realize, oh, that's what they're asking.
Yeah. Yeah.
It's that initial tendency to panic,
Yes.
right? So we learn coping skills as we go along, and those coping skills help to insulate us, and it's an ongoing thing. There's no point in life at which we've learned it all and we know it all and we just 100% there and nothing will ever cause us stress. I mean, there's some people who on the surface look as if nothing ever causes them stress. Bless God for them. Right? But and sometimes we can learn a thing or two or three from them.
Yeah.
Right? But for many people, when things get difficult, if you don't have a coping skill to keep you or to get you through it, you're going to be in problems. And I always tell believers something that Stacy Basdale told me many years ago. You can't worship and worry at the same time.
It's so true. It's true. You can't.
You can't.
You can't say you
can
trust
sing
God
and,
and
you can sing and worry.
yeah, we
But you
can't
can't
worship
worship
and
and
worry. I love that, and I think it's an absolute beautiful way to end today's program. You can't worship and worry at the same time. What has your thoughts? That's my question. What has your thoughts? It's definitely something that we need to pay attention to and take hold of. You know, the Bible tells us that we should think on the things that are true, that are noble, that are good. Yeah, I know that's not always our default, but it's God's word. It's what He instructs us to do, and so we have to trust in His word at all times. Dr. Othello, thank you so much for joining me today. This was a very insightful discussion. I learned quite a lot, and I know a lot of the persons listening to would have as well.
It was my pleasure. Thank you for having me.
Absolutely. I'll catch you guys next week, Tuesday. We're continuing this discussion on mental health. Take care.
Woman of Promise is back. The Grand Reset with our new host, Renata Singh.
Hey, it's your girl Renata, and you can join me and my special guests every Tuesday from 12:15 to 1 p.m. as we touch on issues that impact women of all ages, from knowing your worth and identity in Christ, fostering godly relationships, beauty, fashion, maintaining a healthy lifestyle, and more. And of course, we bring a biblical perspective to every discussion.
It's Woman of Promise, the Grand Reset, every Tuesday from 12:15 to 1 p.m. on Isaac 98.1 FM. Sponsored by Furniture Plus.